You don't get to choose the emergency, but you do get to choose the destination. Whether the patient's a medical patient or a trauma patient, making the right transport decision can mean the difference between life and death. In this video, I'm going to break down to you how to make the right decision for each single patient encounter that you have moving forward. Check it out. Now, before we get into which hospital to take which patient and what to do and how to do it, the first thing I would like to tell you is if a person is alert and oriented times person, place, and time, they have the right to refuse transport to the nearest hospital or to whichever hospital. So just because a person needs to go to the hospital and you assess them and you understand that it's in their best interest and they still don't want to go, we're not able to force them unless it's a very particular situation like a psychiatric patient that wants to hurt themselves or hurt other people, or if it's a minor or there's implied consent. And there's a whole bunch of things to mention when it comes to refusal of medical attention. But in general, before I tell you about your transport decision, for example, why are you taking somebody to a STEMI center? Why are you taking them to a trauma center? I'm going to explain to you in depth why you're being guided to make that decision. It's easier for you to do things the right way when you understand why you're doing it as opposed to just memorizing it. A lot of people just want to memorize the patient assessment, and I think that's great. But if you memorize it knowing why you're doing everything at each phase of the patient assessment, it makes it better. It makes it easier to understand, and also it makes it easier to make the right decision. So once again, patients that are alert and oriented time, person, place, and time have the autonomy to refuse medical aid and to stay home even if they want to. Of course, you try to talk them into it. Of course, you call for advanced life support. And of course, you get them on the phone with your medical director or your medical control so they can speak to them and try to talk them into it as well. But sometimes you have people that have been in and out of the hospital so much that they're tired of it and they don't want to deal with it and they're ready to go on into the afterlife. Now, when we talk about transport decisions, you have so many options. Do I take this person to a standalone hospital? Do I take this person to a trauma center, to a stroke center, to a STEMI center? Like, how do you know where to take these patients? And the reason why there's so many different options, the reason why is because there's so many different medical specialties. What I want you to understand is when you take a person with a STEMI, a ST elevation myocardial infarction, which basically means a person having a heart attack, this person may need open heart surgery. If you take them to a standalone emergency room, the emergency room doctor is not trained to do open heart surgery, and that's why you're taking them to a STEMI center. Same thing, if you're having a woman that's about to give birth, you want to take her to where the specialists are. What are these specialists? These people went to medical school for 4 years, then did a residency that ranged between 3 years to 7 years, and probably did a subspecialty or a fellowship after the residency. These guys have 5, 10+ years training in one particular thing. For example, trauma surgeons, general surgeons, plastic surgeons, cardiologists, radiologists. All these specialties are located at different hospitals. You don't have one hospital with all these specialties simultaneously. So this is the reason why trauma patients are taken to the trauma center, because you have physicians that have been training and treating trauma specifically. You can't, and this goes back to everyday life. Dispersed energy gives you dispersed results. So if you hyper focus on one thing, then you're going to get mastery level results. And that's why you're taking these patients to these specific centers, because that's where the mastery for trauma is, at the trauma center. The mastery for pediatrics is at the pediatric center. So when you have a transport decision and the person's alert and oriented times 3, and you want to take them to the hospital, if they're stable, go ahead, take them to the local hospital. If they're having trauma, take them to the trauma hospital. If they're having a heart attack or something's going on with their heart, take them to a cardiac hospital. If it's a pediatric, take them to the pediatric hospital. Not because I told you to or because your protocol told you to, but now that you have this context, it'll help you understand why it is that you're being insisted to take them to this place. Make sure you make the right decision, because if you take a person who needed open heart surgery to a standalone emergency room, then you're delaying the care in that person, because now they're going to go inside of that hospital and they need to be stabilized, and then they need to call a critical care ambulance similar to the one I'm sitting in right now, where we have to pick them up and then take them there. So it all depends on your region and all that stuff, but make sure you take the patient to the right place, because if you take them to the wrong place, you may be delaying the care and indirectly hurting your patient. Whether you're new to the field or you're a veteran, let's make this a community where we uplift each other and help each other. So go ahead, comment down below any questions you have. To all the brothers that have experience, what are your thoughts? Anything you want to share with the viewers, just comment down below. I hope this helps. And just so you guys can know, there's a resource link in the description box below. I hope this helps. Peace.